familiar with the medical aesthetics industry, whether you are a patient or a provider, you know that every treatment doesn't yield the same results for every patient. Treatment effectiveness is heavily dependent on your age, your health, and even your activity level. So one concern that I'm starting to receive from new patients is, why is my neurotoxins, my Botox, my Dysport, my Jeuveau, why is it wearing off so quickly? Why isn't it lasting the 3 to 4 months? So for anyone new to medical aesthetics, a neurotoxin is a substance that affects how nerve cells function. In medical aesthetics, the neurotoxin botulinum toxin works by blocking the nerve signals to muscles. So it causes the muscle to relax, which also contributes to the relaxation of fine lines and wrinkles. And as discussed before, a lot of the popular botulinum toxins are Botox, you have Dysport, you have Jeuveau, you have Xeomin, you have Daxxify, and I think they're coming out with a lot of other ones, but those are the ones that I've worked with and the ones that I know about, and I know the results that potentially work. Some last longer than others, and then some are more effective than others in stopping the movement of certain muscles. And all of these brands are basically doing the same thing. They're inhibiting the injected muscle from moving, which later, as a result, 3 to 7 days down the line, stops the muscle from moving and contributes to the relaxation or softening of fine lines and wrinkles in the face. That usually lasts between 3 to 4 months. Some patients I've seen it last 5.5 months, but usually 3 to 4 months is on average what they usually display and what the results will be and how long they'll last. In this video, I'll be discussing why most patients may not be getting their desired results after a neurotoxin treatment and what we could do about that later on in the video. And for anyone who doesn't know me, my name is Maya. I'm a family nurse practitioner, and I've been working nearly a decade in the field of medical aesthetics and wellness. I'm the founder of the National Laser and Aesthetics Academy, also known as NLAA, where we train competent and ethical providers. We are based in Fayetteville, Georgia. So if you're interested in advancing your medical aesthetic skills, or if you are a patient and you need a medical spa home, please check out our information in the description box, and I'll see you soon. So why are my neurotoxins not lasting as long as they should? Honestly, it's probably as simple as you not having enough units in the areas. So this is not age specific, but it can be face specific. One thing I've noticed about a lot of patients on average is the procerus and corrugator muscles right here in the middle of the glabellar area, and the masseter muscles have a tendency to have the stronger muscles. They're the stronger muscles, and they usually need the most units. So for me, I'll start low just to be on the safe side, but with those areas, I tend not to. I usually do not start low in those areas because I know that the patient is going to have to come back to receive more units. And then you can also feel that muscle to see how strong it is, especially the masseter muscle. If you know that the muscle is strong, just go ahead and add the units. Save yourself the time. Another reason why your neurotoxins are wearing off so quickly is because you aren't penetrating the needle past the skin. It has to go past the dermis and the epidermis into the muscle to be able to receive the desired results. This is something that I notice a lot with new injectors. They're not all the way sure as to where the needle must go. Certain muscles, they require the entire needle, and certain muscles, you can be a little more superficial. For instance, with the masseter muscle, the entire needle needs to go because you also have to penetrate past the skin and deep into that strong muscle to be able to receive the desired results. And if you're a new provider, new injector, and you're not quite sure and you need a little bit more practice, definitely check out our website to sign up for our preceptorship training. I'll leave it in the description as well. Another reason why your neurotoxins are wearing off so quickly is because your body is just able to clear the neurotoxins a lot faster. As you know, neurotoxins, they are toxins. So for a lot of my patients who do hot yoga, they run every day, and the same instances with dermal fillers. If you are active, your metabolism is a lot higher. So you're able to clear these toxins a lot faster, and you may need them a lot sooner than most people who are not working out as much. So the manufacturers of neurotoxins like Botox and Dysport, they usually give an age range as to who Botox and Dysport are most effective for. And usually that age range is between 21 to 65 years old. And this is important because as we age, over time, our muscle tone weakens, which can also affect the effectiveness of the neurotoxins. One thing I like to tell my patients is not to allow neurotoxins to be their end-all be-all. We know with neurotoxins, they work very quick, and they give great results. But try to utilize other treatments in between time, like RF microneedling in general, facials, the use of exosomes, stem cells, eating correctly, and exercising correctly. Those can all be effective in reducing the look of fine lines and wrinkles instead of just utilizing just Botox or just Dysport. Your body will also thank you for that as well. So with that, I will leave you. Hopefully you learned something to take back to your provider for discussion or to implement into your own practice. So if you would like more information about neurotoxins and you're wondering if they're the best option for you, feel free to schedule a consultation with yours truly. I'll leave the link in the description below. And if you're a provider interested in learning how to administer Botox in an ethical and professional competent manner, feel free to email me at info@nlaatraining.us. I'll talk to you soon.